Really interesting case. This young lady, 25-year-old, came to my office complaining of looseness on a lower front tooth and swelling on the gum on the inside part of the tooth, on the lingual aspect. When I pressed on that swelling in the gum, exudation came out of the pocket. And when I put the probe in, it measured 9 to 10 millimeters on the mesiolingual aspect. The X-ray confirmed severe bone loss and periodontal abscess around this lower incisor with a class 2 mobility, loosened and almost falling out. I searched around for the clues, and lo and behold, I found a piercing in the base of her tongue on the undersurface. And I asked her a few questions about her use of a tongue adornment in the past, a tongue ring or a tongue barbell. And she told me that she had had one in her mouth, and it was her habit to kind of rub it on the inside of the gum. It felt good to her, but that thin lingual plate is susceptible to break down under pressure or trauma. We talked about the possibility. She was afraid she would lose this tooth. She had been told by her dentist that she may have to have the tooth extracted and replaced with an implant. I looked at it and scratched my head and said, if I extract this tooth and graft the socket, what am I going to get? Am I going to get a site that's suitable for an implant? What do I do with the neighboring tooth? Am I going to extract the neighboring tooth as well? Because it appeared to have suffered bone change around it as well. Is it easy to put an implant in a lower central incisor site? Those that have done that case know that there are significant challenges with that thin bone after healing, and where is the head of the implant going to end up? And if I had a choice to save this tooth, that would obviously be my first. So with the LPT, the laser pocket therapy or laser pocket surgery, following the steps of the Lynette protocol, I treated her hoping that I could get resolution. 20 minutes of minimally invasive surgery in the pocket to debride the abscess, to ablate the bacteria in the biofilm, to clean the tooth root surface, to create a durable clot on the hemostasis setting, and to put this tooth away and let it heal. Of course, I took it out of occlusion to make sure that it wasn't hitting hard. I asked her not to check it for looseness and to test it regularly. We wanted this tooth to be peaceful while it healed. She came back to me at a year for that X-ray that I really wanted to get. In fact, a year and 2 days. And lo and behold, on the X-ray, I could see significant increase in the bone density, reformation of the lamina dura and the PDL space. The mobility on this tooth had diminished. It appeared as if we had tipped the scales from degeneration to regeneration. We were definitely going in the right direction here. And I expect that when I take another X-ray at 2 years, I'm going to see even further bone change for the good. The tissue tone was excellent. There was no discharge. The pocket depth was shallow. And the patient was so thrilled with the outcome, almost as thrilled as I was.